What's up, guys? I'm Dr. Donald. I'm one of the co-founders of Kinetic Impact, and today I wanted to talk to you about knee pain when running, how to manage it, what you should do, what maybe you should avoid, and address some of the myths. And then at the end, I want to give you guys a routine that ideally will help you in the long run if you put enough time to it. So first things first, we see so many people that come into our office and are concerned with their knee pain and have been told by maybe well-meaning practitioners that they shouldn't be running and or do any high impact stuff with knee pain. And I want to be the first to reassure you that that isn't really necessarily true. Now, it's not just being willy-nilly about it and just rubbing dirt in it and ignoring the pain. There's some things that you can do, but first things first is I want to address that myth is that you shouldn't be running, because yes, that it is a myth. And I want to address the myth that running is bad for your knees, because actually that's not true at all. And, we know if we look at three groups of people, one being sedentary, one being a recreational runner, so they run occasionally, maybe 10 miles a week or something like that, and then elite runners that run 55 plus miles a week, which is an ungodly amount of mileage, right? Which of those groups do you think has the least amount of hip and knee osteoarthritis via x-ray images? The answer is the recreational runner. So maybe it isn't the running itself that is the issue for people experiencing hip and knee problems. It seems to be the dosage. If we could find that Goldilocks dosage where it's not too much, not too little, just right, that's what we're after, right? So first things first, if you do have symptoms when running, we want to first find a maximum tolerable dose that doesn't flare things up, right? And I say maximum tolerable dose because it doesn't need to be in the complete absence of pain, but it really shouldn't wreck you for more than 2 days when you run, right? So if that's 1 mile for now at 3 times a week, that's what it is, right? So you're gonna have to be honest with that's step number one, is finding a maximum tolerable dose. Okay? Step number two is implementing strength training and even jump training to your routine at least twice a week. We know those who strength train with resistance and weights and do plyometric training, those runners have better performance. And those who stick with it for longer have an increased performance. Not only that, we know that those who strength train have, in all sports, have a decreased risk of lower limb injuries, right? So I want to show you guys a little bit of a routine, a simple routine that you guys can do. You're just going to need some free weights, because yes, you do need some weights for this, okay? So first thing is at least 2 times a week. So I'm going to show you a knee dominant day and a hip dominant day. And I like to pair these together because they work really well together. They work all the muscles around the hips and knees and get you ready to run. Right. And I think it's important to also pair these with some upper body stuff that you can just throw in on those days as well, so you get a full body exercise. But I'm just going to show the lower body stuff. Okay. So first is going to be more of like the knee dominant day. And we're going to do a double leg squat, a single leg squat, and then calf. Calf's always going to be a part of it as well. Okay. So first is a squat, right? Just a traditional squat. If that's an issue and that's difficult, use hand assisted like a rail or even a door with door handles, and you can offload some of that with some of that weight with the hand, right? So assisted, non-assisted, then you're going to hold weight and go here, right? That's the progression, but I want you to work to getting weight in it as fast as possible, right? Then the other quad dominant exercise is a split squat. Again, you can do hand assisted to start if you need it, but ideally you have some weight in your hands and you're going up and down, right? Up and down, right? I want you to be able to do 3 to 5 sets of both of these exercises at about 6 to 8 difficulty level, right? I want the weight to challenge you, but you have a couple left in the tank, right? So it's going to be 3 to 5 sets, and let's just pick, for simplicity's sake, 8 to 12 reps. But again, it has to be 6 to 8 difficulty, where it's challenging you. That's really important here, okay? And then the staple calf exercise is single leg, one leg up on a step. This stays straight as possible. The heel comes up, control, tap the heel. Heel comes up all the way, control, tap the heel. And I want you to have some weight on here. You should be able to do a lot. The calf takes on 3 to 8 times your body weight every step you take while running. So these calves need to be strong. These help attenuate some forces, okay? So that's that's day 1, okay? And that looks like double leg squat, split squat or single leg squat, calf raise. Okay? And then simply for the hip dominant, we're going to have a 2-legged deadlift, a single leg deadlift, and again calf raise. Okay? So the double leg deadlift, you're gonna have a dumbbell, which I'll get right now. Heavy dumbbell or kettlebell. Then you're going to place it in between the heels or the ankle, right? You're going to keep those shins pretty vertical so you have stretch in the back of the legs here, right? So the knees don't come forward on this lift because it's a hip dominant exercise. In order to get the back side of the legs, the shins need to be vertical. Then you're going to stand with it, tap it on a pane of glass, stand with it. Okay, that's the double leg. This should get really, really heavy. We need to get this to get heavy in order for it to be challenging in the 8 to 10 reps. Okay, and then the single leg, you're going to use this hand assisted to make sure balance is not an issue. Okay, and then you're going to go single leg, push one leg back, soft knee, let the shin be vertical, right? Don't let it travel forward or you'll feel it more in the front of the leg instead of back of the leg. You should feel hamstring and glute here. And then you'll stand. Again, 8 to 10 reps on each side. Ending with calf raise. Heavy, heavy, heavy. Okay? And this over time should really help build the legs. Right? As you get really good at this, then you can start exploring other options. Trust me, there's plenty of different options to make the leg muscles really strong. I just want you guys to have a starting point. And once you get comfortable with this, by all means, go explore other options to get stronger on the legs. But I implore you to strength train and even jump train to supplement your running. Right? That should help with a lot of like the knee issues that you may have, because then you have larger muscles to help you attenuate some of the forces and you won't have to rely on like the tendons, ligaments, cartilage as much, right? So again, running is not bad for your knees. Find a maximum tolerable dose. Do these routines twice a week, one knee dominant, one hip dominant. I'll put them up on the screen somewhere. And please, if you have any questions, reach out to us. Our email is info@kirehab.com. You can find us on Instagram @Kinetic Impact. You can DM us there. Please, if you felt this was helpful, like, subscribe, share to friends. So thank you again for joining us, and until next time.